more information on Medicare Basics. This is an important presentation for those people who are getting ready to retire or beginning to think about retirement. Medicare can be really complicated, and there's a lot of different things that you need to take into account as you begin to prepare for this part of your journey. Dominic Bottenfield was our guest speaker from AHG Benefits. Dominic is a specialist in Medicare space, also provides group and individual benefits as well. So we are turning today's presentation over to Dominic to tell us more about Medicare. Thanks for joining.
Particular situation as you look at Medicare. So just some of the basics. Medicare Part A is really the first part that you guys will that somebody would consider when you get close to retirement. It's the hospital insurance. It carries its own deductible, and there's typically no premium for it. As long as you've worked 10 plus years and you've paid into the system, then there's no premium for that Part A hospital insurance. It carries a deductible just like a group plan, but it's a little different from a group plan, as it's a deductible that they put in place per episode. I give an example. If you have Part A and you go to the hospital in January, they charge you a deductible. It varies each year. I believe this year it's about $1,700, but it goes up as the years go by. And then say you go back to the hospital in April, it's a whole new separate deductible. So it's a little bit different than how a group plan works. And we'll talk through some strategies about how to deal with those separate per episode deductibles later on. One thing to consider, and this is something Sarah is an expert at, is if you take Social Security, if you take those benefits, you get automatically signed up for Part A. A lot of people don't know that. And that can be a little more complicated depending on a couple of things. So one would be, do you currently save and contribute to a health savings account? And are you using a health savings account kind of like a retirement vehicle? Because if you take Part A, you are no longer eligible to contribute to an HSA. Another consideration, which again when I see people get in trouble with Medicare and whether they stay on their group plan or not, is whether your current employer is over 20 employees or less than 20 employees. It actually makes a difference on how your claims are paid. So if you stay on a group plan, but you signed up for Social Security and you got automatically signed up for Part A, and then you're on a smaller group plan, Medicare becomes primary. And so you have less paid towards your current claims. So that's a key consideration. This is why ahead of time you want to get in touch with somebody like Sarah, like me, to be able to plan out what do you want to do when it comes to retiring and maybe jumping off the group plan, whether you need Social Security right now, how that'll work in your budget and in your life. Once you've gone through that kind of first step, you figured out what you want to do with Social Security, you figured out that it's okay to be on Part A and you're still on a group plan. Now it's your considerations on whether you want Medicare Part B, which is physician outpatient coverage, separate from hospital. It's got its own co-insurance payments. There's no coverage on dental, vision, prescription drugs, long-term care, those types of things. And then the cost can vary based on your income. So again, you'll want to know those costs while evaluating, do I stay on a group plan still? Can I afford to go on to Medicare fully? What Medicare does, the Office of Medicare considers your income-related monthly adjustment amounts. And that's based on what your gross income was from 2 years prior. So Um, there's a table that we use that adjusts every couple of years, but basically, if you might have higher earnings, a lot of retirement income that comes in, or if you sold a house or something recently, there's capital gains. They look at how much money did you make in that year, and then they adjust how much you pay for Part B, right? And so it's just a good thing to know. Consult with someone to figure out what's this all going to cost me. So Part B is kind of important to know. And then Part D, that is your prescription drug coverage. This by far is where we spend the most time with most people that come to me asking me what we should do. We spend a lot of time on, are your prescription drugs even covered? What a lot of people don't know is that, for instance, if you were on a group plan with a Blue Cross Blue Shield or United Healthcare, something like that, that the drug list that those insurance companies have and that will cover can be different from what Medicare would cover. And so I have a personal story and this is going back a few years, but my mom was taking Humira, I think, from her 50s on, and then she was looking at retiring. She did, and she moved off of the group plan and onto a Part D prescription drug plan. At that time, Humira was not covered by Medicare. So she had to, a prescription that was working for her that she was taking for several years, she had to change completely. And then what ended up happening is the drug that was covered, this is for arthritis. I don't know if that matters, but she had to take a 30-minute, she had to drive 30 minutes to the hospital and get an injection once a week. So she started to have to do that instead of Humira was shipped it to her house and she was able to administer that herself. So that's an example of how things can really change if you change from a group plan to Medicare. And so you'll want to have a list of your prescriptions whenever you are deciding or thinking about moving away from a group plan to Medicare, because there's several different prescription Part D plans out there. They have different coverages available to you, what it would cost for copays. Some of them have drug deductibles. And so we spend a lot of time when we work with people going through what Part D plan would cover this prescriptions you're on, and then so that there's just not as much disruption when you do leave that group plan. The cost for the prescription drug for the Part D can vary a lot as well. They also use the IRMA calculation in that. And so if you're kind of a higher earner, it can cost you a little bit more. And that's important to know all of the different costs with Medicare and how it compares to what you'd be paying on your group plan or not. There's also a late entrance penalty consideration. What you need to know there, and this typically should be provided to you by your employer once a year at least, is your current group employer plan creditable for Part D? If it is, you most likely will not have a penalty. If it isn't, then, and you're 65 and you haven't signed up for Medicare or the Part D, there's a potential that you'd have a penalty there. So it's really important to understand those things. And I'd work ahead of time. If you turn 64 and you're starting to think about retirement or Medicare, consult with me or consult with someone that can, give you those considerations ahead of time. So earlier I mentioned, Part A is hospital coverage, and it has a deductible per occurrence. If you have an unlucky year where you go to the hospital maybe 2 or 3 different times throughout that year, there's a deductible each time. There's also that co-insurance for the physicians and office visits. And so is there something that would help cover those gaps in coverage? There have been for a long time, and we'll kind of go through the 2 different options that you guys have. They call it Part C Advantage plans. They can lower that gap in coverage. Basically, it works kind of like a group plan. So it's kind of they bundle Part A and B and D, and they make it look like a group plan, with the one exception being that they still go by Medicare's drug list and not a group plan drug list. You have a network just like you do with the drug plan. And so you got to check that your providers are in network or out of network, depending on the Advantage carrier that you are working with. And then they bundle in coverages like dental, vision, hearing. Some are offering gym memberships nowadays. You still pay for your Part B coverage, but then the supplement will pay for a lot of the differences in the deductibles for Part A or the co-insurance. It'll lower those. You can enroll at age 65 and at open enrollment or with a special enrollment without taking any health questions. So they will automatically accept you at age 65. Then there is, I'd say it's been around a lot longer, and probably more people have been enrolled in this in the past. It's starting to change. But then there's the supplement plans. They basically cover everything from Part A and B, except there's a small Part B deductible. I think it's about $260 this year. It goes up slightly each year. But after that deductible is paid, everything else is paid by this supplement plan. They don't have the coverage for dental or vision, gym memberships, or the hearing aids. And then you still also need to buy a Part D plan with these supplements. But your network becomes nationwide. One of the things that that I found that kind of matter to a lot of the clients I've worked with. Medicare is accepted at like Mayo Clinic. It's accepted at University of Iowa. It's accepted almost everywhere nationally. The Advantage plans, typically almost none of them are accepted at Mayo. And so there's a difference in considering supplement versus Advantage on what are your needs for care, depending on the network that you want to continue to go to, right? The Medicare network is vast, and supplement plans work anywhere that Medicare is accepted. And then the cost can vary based on the carrier. And so there's a lot of different carriers to consider. You want to work with someone who can show you the differences in cost. But the coverages are basically, if you're on a typical Plan G, the coverage is the same whether you're with a Blue Cross Blue Shield or United or Humana or Aetna or any of them out there. And then to be enrolled, there's no health questions or denial at your initial enrollment period. That could be at any time that you decide to take Medicare. So if you worked until you're 70, there's no health questions at all. If you decided you want to retire now, jump off the group plan, you can get enrolled into a supplement plan no matter what your health is like. And I put in a big however there because this is kind of a big consideration for most people. If you enroll first in an Advantage plan and then you jump to a supplement later because you liked either the network better on the supplements or you like the coverages better because Advantage plans don't pay typically as much. You know, they have deductibles, they have maximum out of pockets, those types of things. You're not guaranteed to get onto a supplement plan. So say you enrolled at 65 into an Advantage plan, you're very healthy in life, things are going well. And then by the time you're, 68, 69, something like that, you're starting to develop some health issues. It's not guaranteed that a supplement would ever take you if you've started on an Advantage plan. They have you fill out a health questionnaire and they'll evaluate it, but they do not have to give you coverage if you started out with an Advantage plan. One of the things I typically advise is take a look at, in general, people don't typically get healthier as they age. And so it might be lower cost to be in an Advantage plan, but with insurance, you pay for the costs two ways. You pay it upfront as a premium. You would also pay it then on the back end if you have claims. With an Advantage plan, you pay less upfront, but if you use it, you pay much more. Supplement is the exact opposite. You'll pay upfront for better coverage, but then if you use the plan a lot, you don't pay a lot. So it's a good consideration, at least when you'll want to investigate it before you make your choice, before moving to one or the other. Some other key considerations. This is something that you'll like, again, at age 62, you're eligible to take Social Security. You'll want to talk with someone like Sarah on what you should do, because it can impact your options at age 65, possibly. Because taking Social Security automatically enrolls you in Part A. That's the tricky part. So work ahead of time, work with an expert. The employer sides we talked about. And then also if you're using a health savings account, you'll want to look at those types of things. How do you want to plan your retirement? What do you need financially to make your retirement comfortable? And then at age 64 and a half, this is really when you want to evaluate Medicare versus staying on your group plan. And it's because you get a window to initially enroll in Medicare. It's 3 months prior to your birthday month, and then 3 months after you're allowed to enroll in Medicare. It's like a 7-month window there. And this initial enrollment period, it determines if you get any lifelong penalties, whether your current group plan is Part D creditable or not, whether you get guaranteed issue supplement coverage, because they allow anybody to get a supplement as long as it's immediately after that group plan, but later on they could deny you, or transition from the group plan versus the Part D creditability. After 65 and you're still working, there are special enrollment periods. That's basically any time that you would want to decide to take Medicare and Social Security together. If you're on a group plan, you can delay Part B without penalty if your employer is over 20 employees. And if the group plan is creditable for Part D coverage, you can avoid Part D penalties as well. So it is possible to continue to work until your 70s if you want. But there's just those key considerations. How big is your employer? Do I want to take Social Security now? If your employer is over 20 and their group plan is creditable for Part D, most likely you have options where I can take Social Security or I don't have to. Sarah might be able to back me up on this, but the longer you delay Social Security, the higher the payments can be. So those are things you want to get a good, a sound Medicare advisor. You'll also want to have a sound financial advisor to help you through these things.
Yeah, great points there, Dominic. I think I'm just gonna chime in on one little thing that you said there. We're talking a little bit about HSAs. I'd be interested in your thoughts on this. We typically tell people if you're thinking about retirement and you're enrolling in your benefits for the year, we typically tell you if you've been an HSA user, move off of that HSA at least a year before you're thinking about going on to Social Security. Is that kind of generally the advice you'd give people as well, Dominic?
Correct. Yeah, because they can do a 6-month look back period at whether you contributed to the HSA or not. So some people get confused on, well, I have an HSA that I've built up fairly large. Up until the point where, you're 6 months before you've jumped onto Medicare, that money is still yours. There's no penalties or anything like that. But it's the contribution towards that HSA going forward that becomes illegal once you jump onto Medicare, right? And they can even look back 6 months and maybe potentially penalize any contributions. So, good point, Sarah. And just one of those little extra complications to consider as well with Medicare. So, my advice, compare, have someone help you through this. Consult a Medicare expert early. I've had in the past several clients ignore the Social Security or Medicare letters that show up at their house. Don't ignore them, open them, make sure that you're planning ahead. You have people that can help you with that. Don't be afraid to reach out to somebody right away to consult and help. Some things to have when you're working with someone like me, Sarah, another consultant, have your income from 2 years prior, whether you're married or not, if you're married, if you're filing jointly or not, your future expected income. If you want to continue working, is it full-time, part-time? Do you own a business? Those types of considerations can be impacted. What are your group plan details? What's the size of your employer currently? Do you have the HSA? Have a list of your current prescriptions. And what I would say is that also, if you've already had talks with your doctor that they want to move you to a different prescription because one's not working quite well or whatever, your doctor might, if they don't know that you are potentially moving on to Medicare, your doctor might be looking for a script that is covered by your group drug plan. Well, those can vary greatly from what Medicare will allow on their drug list, right? And so if there's been a discussion that down the road, if this isn't working, they want to potentially move me to this drug, we need to know that too, or that'll at least help, because doing a search of all the different drugs that you currently take makes it a lot easier to jump onto a Part D plan that will give you good coverage and allow you to not have to have a big disruption in your in what you're used to taking. If it's working for you, you hate to move away from it if you don't have to. Also,
Hey, Dominic, we do
network
have some
needs.
questions. Sorry, we do have some
Sure.
questions in the chat that I want to make sure we get. There's a specific question about HSAs, saying if you have an HSA and you're not contributing to it, are you still able to utilize it to supplement your deductibles, like any of like costs associated with health, anything? And likewise, if your HSA is invested, you're receiving gains. Is that considered a contribution? I thought we'd pass that on to chat about that a little bit.
Well, the first part of that question, can you still use it for health related deductibles, drug coverage? Yes. What was the second part of that question?
Second great part is, so if I've got my HSA invested, so instead of it being like in a checking account type HSA, if it's a fully invested HSA, so maybe it's in the S&P 500, and it gets returns on that, are those returns considered contributions?
Oh, great question. No, they're well, you know what? That's a great question for after you're on Medicare. Um, you know what? Let me write that down. So, uh, if you're making 8%, something like that, you have 15, 20,000 in an HSA and you're making an 8% interest, and now you've decided to take Medicare. Let me run through that scenario and I'll have to get back to you on that. Is that okay?
Yeah, I'll sure send that out to the group. I don't believe that they are, but I would appreciate you fact checking us on that, Dominic.
Yeah, great question.
We got another one here in the chat. My husband is turning 65 and he began receiving Social Security benefits at 62 and a half. He is on my group plan and I contribute to my HSA. Is that a concern?
The under 65.
He is, yep, he is. He started receiving Social Security at 62 and a half and he's
And she's on
on
the,
the group.
okay. Uh, no, she can still contribute to the HSA. She's on a group plan and not on Medicare. Is he
He
on,
is
and
on
he's
her
on her
plan.
group?
Yep, yep. He is
So
her dependent.
he can do it as well.
Perfect. Great questions from the chat. I have
Another
a
thing you
question.
guys, yeah, go ahead.
Another one, how, if you had a perfect world, this is a question that I get asked a lot, is if you had a perfect world, how far in advance would you recommend people sit down and start planning Medicare? So if I want to retire at 65 or 62, when do I start sitting down with somebody? What's an ideal time frame for you?
That's it. That's 62 and a half age. I would sit down even at 61 and a half or 62 and start talking with you, Sarah, something like, where we can plan financially how you want the next 10, 15, 20 years of your life to go. Um, and then bring me in as well if you need to figure out, because what we've had a lot of conversations on is, all right, I'm 62 and a half and I do want to retire. You still have to pay for regular insurance, whether it's through a, a single plan, a single policy plan or not, to get you that 2.5 years up to Medicare. So the sooner the better, 62, 62 and a half, right in there, I'd start planning ahead and talking with people.
We usually tell people 6 months to a year ahead of time. You should probably be starting to talk to people about what your benefits would look like. Does that kind of line up with what you would think?
Yeah. Yeah. It's just when you sign up for Social Security, you're automatically signed up for Part A. So that's a big consideration. Part A gets tricky. If you're with a large employer, you probably don't have to worry about it as much, but if you're working for an employer who's under 20, when that Part A becomes primary on paying claims, that can really I've had it catch people where they didn't know that Medicare pays for your hospital claim and they don't pay as much as your group plan. And so it can ding people. So yeah, you want to know that right away if you can.
Awesome. Thanks. I don't see any
One,
other
one,
questions in the chat.
one thing, this will be a new little, I don't even think I put this on my uh, screen, but if you have an back to the HSA, once you're 65 or older, you can still use what's in your HSA to pay for your Medicare costs tax-free. That includes the premiums. So,
Great. Thank you. So once you are on Medicare, so if we're going to stop using our HSA the year before we transition over to Medicare, once we're on Medicare, we can absolutely use those HSA
dollars again for costs associated with deductibles or maybe premiums from your Part B or a supplemental program that you might purchase.
Correct. Yeah.
I know that this is kind of wrapped up, and that there are people kind of typing in the chat. So I'm going to give people a few more minutes to put those questions into the chat. And before we stop the recording, I have a couple other questions that I'll put in here for you. One of the things that I've got a question for you on, Dom, is if you provide some kind of like a checklist for applying for Medicare. So maybe something that people could walk through and be like, hey, maybe I should be doing this. Have I thought about this? Is there something like that that you find is helpful or available?
Yes. Yeah, I have something like that. And if we have emails attached to these invites, I can get that out to people, but definitely just a checklist of things to consider, things to have prepared. But yeah, and I can send that to you, Sarah.
Perfect. Well, the last question I have is how do you see people change their plans? So you talked about this a little bit as we were talking about the difference between Advantage and supplemental programs. Is it real common that you see people switch plans because you have an annual enrollment program, an annual enrollment with Medicare, just like you do with your group plans? So you can change throughout your lifetime. Do you see it happen often that people are changing plans, or do people tend to get on one that works for them and they just stick with it?
I see my own clients not changing as much. I do see in general a lot of people changing because I kind of think that there's a lot of push to try to get people to change. So there's advertising all the time. There's people constantly making phone calls. So the big question that I always present to a client is, do you intend to be healthy or healthier as you get older, or less healthy? And then it's the consideration of, do you intend to have more money as you age, or maybe less money as you age? So if you're in your 70s, 80s, 90s, it's just that consideration of whether you could pass underwriting, answer health questions honestly, and be accepted is basically what that means for a supplement plan that might cost more on the front end, but it costs way less when you're doing hospital visits, when you're actually using our healthcare system. Versus an Advantage plan is pretty cheap to be on. Some are $0 costs for an Advantage plan. They have a whole bunch of odds and ends like gym memberships and dental and vision, but they don't pay as much, and you're restricted on network. And so each individual is, can have different opinions on and different thoughts about what they need, but at least have that conversation, because it's not guaranteed that you can switch. You can switch Advantage plans to Advantage plans. You can switch supplements to supplements, but the difference between switching to an Advantage to a supplement, there's a lot more to it than maybe people realize. So,
Thank you. We do have a couple other questions here in the chat. If my husband is on Social Security and Medicare, and I am still working and on a group plan, am I limited to the individual limit for the HSA, or can I contribute the joint limit?
I think you are, if I heard that right, Sarah, their husband is not covered under their group plan.
Correct.
They can only hit their individual limits. They can't max it out to the employee spouse limit. So they could do a catch-up contribution of $1,000 if they're over 55, but they can't also contribute the spousal limit.
Kind of a tag team to that question. So if that same person has to stop their HSA contribution 6 months prior to getting on Medicare, which we know that's you're going to definitely need to do that, can they contribute the maximum amount in the first 6 months of the year?
No, Medicare actually will Medicare will look at it as you're only able to contribute the average monthly amount. So they'll, like if you didn't turn 65 for 6 months, you could maybe get away with putting in 6 months worth. If you take was it 5,500 divided by 6, you could put in that amount. Anything more than that, though, they could ding you.
Follow-up question to the the person who's already signed it, their husband's already on Social Security at 62 and a half, which means they've been automatically signed up for Part A. Is there a way to get rid of Part A?
Unfortunately not. Not that, well, I don't believe there is. You're automatically signed up, and once you're in, you're in.
But that doesn't necessarily mean that, that becomes an issue. Like we were saying, you're not using Medicare until we're 65. You're enrolled in the Part A program.
Correct.
So,
It's part, yeah.
Yep.
Part B is the one where so if your husband's group still on the group plan with you and your employer is over 20, then his claims won't be affected. Even if he turns 65, stays on your group plan, he can still be on Part A and still receive Social Security. It just depends on how big is that employer. If it's over 20, you're good. And is the prescription drug plan on the employer plan, is it Part D creditable, which any HR person would be able to tell you. Most of the group plans are Part D creditable that we sell here in Iowa, but some aren't. So we just want to make sure you're aware of it.
Right. Okay, well, I'm going to go ahead and stop the recording, but please do not stop asking questions. I just want to make sure that people who maybe wanted to ask a question don't feel like they are required to. So we're stopping.